Welcome, everybody. Welcome. Hello. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachola, and I'm from PAR5 Physical Therapy, a physical therapist clinic in physical therapy clinic in Randolph, New Jersey. And I've partnered with them to bring you an easy and educational workday session. So today's session is Back Pain 101. A little bit about me. I've been a physical therapist for over 25 years. I opened up my practice in 2019, and I specialize in orthopedics and sports injuries. And I'm also a Titleist Performance Institute certified golf medical professional. So this class that we're going to go over today is something that I take all new clients that come in with back pain. So a lot of it is useful information, but just like every other talk that I've given, because I'm a physical therapist, I have to give this disclaimer. So if you're dealing with a specific pain or injury, this is going to be general information that is targeted at a broad population. So be aware that if you have issues, you're going to need a customized assessment and treatment plan to successfully treat all the components that are the root cause of your specific dysfunction. So, just to make sure that this is just general information for everybody else. I've dealt with back pain in the past. My first issue was when I was 18. I was in the football. I was playing football in high school, and I hurt my back first doing a deadlift in the gym, and that was my first foray into physical therapy. And then I did it again in college. So I've been dealing with back pain as well for many years. And I've been treating it myself with exercise and stretching. And that's kind of like how I got involved into physical therapy. So I hope a lot of this stuff, this is some of the things that we're going to be covering today, was what my first physical therapist told me back when I was 18. And it kind of stuck with me. So hopefully you find this helpful. So the first, the source of the back pain isn't always the cause. And we'll go into more detail. It'll make more sense later. But first, we just want to cover basic stuff, like what is the spine, right? So it's made of joints, discs, nerves, muscle, and fascia. It's a very resilient structure. The bones that are in the spine, they're called vertebrae. They're joined together at the joints. We call them facets. And the disc, it's a jelly donut. It's kind of like has a hard outer covering and a soft inner. You've probably heard about that reference before, the jelly donut hypothesis, right? And then we have nerves that come out of it, and they go out to the limbs. And then around that whole area, we have what we call the core. We're going to talk about that a little bit more later. It's a muscle group that comes from the back, lower back, and wraps around the front. And that really gives a lot of stability and support to the lower back. So this is a picture of the spine. We have the cervical, the thoracic, and the lumbar vertebrae, the neck, the mid-back, and the lumbar. Most of the problems we see with clients are in the lumbar, the lower back, but I do see a fair share of cervical neck problems. Now, it's very rare that we see any thoracic problems, mid-back problems, because in the thoracic spine, that is also connected to the ribs, and that rib cage connecting to the mid-back gives it a lot of stability. So herniations and facet joint issues are very rare in those areas. Not to say that it doesn't happen, but it's very rare. We mostly see herniations and disc problems in the lower back. But again, the pain could be caused by something else. So 3 common causes of back pain. So most common one is a muscle spasm. And then we have to ask the question, when it is a muscle spasm, is the muscle in spasm because it is tight, or is it because it's weak and you asked it to do more work than it can tolerate? All right. And then we ask, why does the back get tight? Are those muscles being overworked because there's another weakness somewhere else or another tightness somewhere else that causes problems and the muscles get tight? And that muscle imbalance, is stretching indicated? Do you stretch? Or I've had a client one day that came in with back pain, and they were stretching and they were saying that the back never got any better because they were really flexible, but what they really needed was some strengthening. So if you're just thinking that stretching can solve all the issues, I want to make sure that we're covering all the bases so that you become strength. You have strength, and you have flexibility, because flexibility without strength is dangerous, but strength without flexibility is useless, right? So another reason, another cause for back pain is a joint dysfunction. Now, those facet joints that we mentioned earlier, they're like the shingles of a roof. They're kind of stacked on one another like this. When we flex forward, they kind of open. And then when we extend backwards, they kind of close. So that surface, that sliding surface, can often become arthritic. And then that can limit the range of motion as well. All right, arthritis, joint inflammation, degenerative changes happen to everybody. Whether or not they cause pain is another issue. All right, and then we have the disc pathology. The common, oh, I have like a disc herniation. Oh, my back is broken, stuff like that. You know, the disc, like I mentioned earlier, it's like a gimbal. It has an hard outer covering and a soft inner to allow for motion and absorb shock. Bulges, herniations, impingement, those things are what you hear mostly, but they are often unrelated to pain. I'll tell you this, because pain is complex. It can occur in the complete absence of tissue damage. You can have nothing wrong with you. Your tissues could be healed completely and you still have pain, because pain comes from the central nervous system. It's not an input, it's an output. We think about it that way, right? So we have these nerves that come from all parts of our body. They go into the brain, and your brain has to interpret that, has to determine whether or not that signal, that electrical signal, is something that needs to be paid attention to, or is a threat, or do I need to ignore it? So there's a dial in there in the brain that kind of gives us a pain sensitivity dial. When that dial is turned up, we sense or interpret stimuli, the electrical signals, as being a threat or being painful. And when that dial is turned down, then we don't pay attention to pain. We forget that it's there. And there's different ways to affect that through medication or other things, because pain happens from a physical standpoint, from a neurological standpoint, from a psychological standpoint, and also from a social standpoint. So stress, your environment, fatigue, dehydration, those are all things that can affect how much pain you have. One simple analogy that I tell people is that imagine now, if you close your eyes for a moment and think that you are on vacation and you're on a beach. You're on a beach and you're in the beach chair and the sun is coming down on you, and you hear the birds and you hear the waves crashing, and you reach down and you feel the sand between your fingers and your toes, and you're at rest, right? So your level of threat during this time that you're on vacation and you're on this beach is very low, versus if you are walking in, say, New York or Newark or some urban environment, and you're in this dark area, this dark alley, and you can't see very far in front of you, and it's at night, and all you could hear is people in the corners making noises, rumbling, and you can't see and you don't know what's going to happen next. Your level of threat is higher. So your brain is like that. As your brain changes from one to the other, to this fight or flight status, to the rest and digest status, we get this pain sensitivity dial that changes. So the problem with treatment of pain is that often it's kind of directed at the results. Like, oh, wait, it hurts right here. That's where I'm going to treat. And if we treat the pain, then that's basically a temporary relief. That's why all these things like, oh, I have this back pain. I've gone to PT before and they've done this and this and it feels good. And I put ice on it. It feels great. But then the pain comes back because you're just treating the results and not the causes. And the treatment can look very different, right? So we have like massage, working that soft tissue to relax the muscles, the tight muscles. That feels great. Oh, I get off the table, I feel great. Or you can go to a chiropractor. Physical therapists can do joint manipulations as well. We get the crack, or we get the adjustment, as they call it. That helps because my back goes out. I need to have it adjusted. Actually, the back doesn't go out as much as you think it is. But those cracks feel good. It doesn't, can't really deny that, but I don't know if it's 100% useful for the root solution. Or we can just do exercise. Oh, yeah, I'm going to do some squats, lift some weights, get muscles stronger. Or the last solution is surgery. And I always tell people that come to see me that have chronic issues is that surgery should be your final option, no matter what it is, because there's a lot of different ways or a lot of causes of back pain that if you just do a surgery to address where the pain is and you don't address the causes, that surgery is not going to work. You're always going to, you will probably always have back pain because the surgery didn't address the root cause of the problem. But I think overall, medical knowledge and how we treat pathologies changes every 5 to 7 years as research is done and scientific stuff is put out, right? So it changes what we know, what causes back pain and what are effective treatment strategies. So, but we do know that through multiple research studies that passive modalities are less effective than active modalities. That means that if you go to whoever you are seeing and you lie down and have something done to you, and then you leave expecting that to be the only solution, that is not going to be the solution. We want to be combining the neural causes, what goes on with the nerves, central nervous system, not just the nerves that are in the periphery, and also address the mechanical causes of pain. So it's a fluid experience that that I mentioned earlier, influenced by many factors. So when you're stressed, when you're happy, those also changes the pain. So, things that were affected before, where we just put some e-stim, get some electrical stimulation, get a TENS unit and put some ice on it, that's not going to help. Ultrasound is not going to help. I'm going to tell you multiple research studies that show that long-term, those don't help. Back pain comes back. So then this is a big question that I ask everybody, is answering this question can help drive an effective treatment plan. You have to understand what activities, postures or positions, whatever you want to call them, or movements make it worse. Okay, we have to compare standing versus sitting, bending versus lifting, yard work, sleeping, whatever, right? We have to dive down and see, all right, yeah, it hurts when I sit. That's what a common thing that people say. All right, then you can't sit right now when you talk to me. It's like, no, it hurts when I stand up out of a chair. Then that's different. All right, so pain with sitting versus sitting to stand is a movement. Sitting is just a position. And whether or not sitting hurts versus sit to stand or standing hurts, those kind of play into the algorithm that medical professionals use to successfully treat back pain. And then we ask the other question, what makes your back feel better? Lying down, sitting down, stretching, or walking, right? So we look at, okay, when your back is flared up, what position makes it feel better? Not I take a medication or I apply Voltaren gel on it, or I put this icy hot. That's a passive thing. Again, we have to ask what positions make you feel better, reducing the pain, okay? If there's no position that alleviates the pain or makes it feel different or makes it feel worse, then it's not a mechanical problem, it's a chemical problem. And you could probably only address that with addressing the neurological issue, like central nervous system, like relaxation techniques, stress reduction, not exercise or stretching. All right. So once we learn activities that hurt and that leads into positions and postures that aggravate the back, we try the opposite for relief. It's a process or this the theory of directional preference. All right. So it's bending versus extending. Now you could even try this very simply. If we just look at the back and think that flexion, bending forward, is one direction, and extension, extending, is going backwards. Any movement that does one, if it hurts, the opposite should make it feel better, okay? Or at least change your positions. Generally, for stenosis or arthritic types of changes in the back, standing is worse than sitting, right? Then if standing is worse than sitting, then that means just sitting on a couch. Sitting reclined, your back is flexed, okay? If your back feels better in a flexed position, That's one, all right? And then standing and walking, that's an extended position. That makes it worse. So we know that your directional preference is in a flexion, flexed position. So then exercises, treatment will be directed into that position, flexion. We're going to start to bend. We're going to start to do stretches in that direction. We're going to avoid initially extension positions that exacerbate your symptoms. And so you can even stand up and try, see if you're sitting now watching this, if that makes your back feel worse, then you stand up and say, all right, not the movement, not the sit to stand, because I know that's probably going to make, my back feels stiff. That's fine. It's a different scenario. We're talking about prolonged standing versus prolonged sitting, just a position of flexion and then the position of extension. The transition between the two is another thing that we need to talk about later. Actually, we'll just cover this now. So the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. If we're talking about the back, all right, the back is classified as a stable segment, right? The lower back. The mobile segments that surround that are the thoracic spine and the hip, one joint up and one joint below, or one segment up and one segment below. Oftentimes, back pain is caused when the back becomes mobile. It becomes an unstable segment because the mobile segments, thoracic spine or the hip joint, lose their motion. So essentially, if the hip becomes so tight that you lose mobility in the hip, your body's like, all right, I've lost mobility in one segment. I need to borrow that mobility and get it from another thing. Then it usually results in knee pain or back pain. So if you're having knee pain, got to check the hip. Is your hip as mobile as possible? Or again, like we're talking today, if your back hurts, it might be because your hips are tight. They don't move. So the role, those two segments reverse. The back becomes mobile and the hip becomes the stable segment. And then we've got problems. Or it can come from the thoracic spine, right? If your mid-back is limited with movement, especially rotation, then your lower back becomes unstable. It tries to make up for that lost mobility, all right? And then everyone, this is my whole theory of why I started practicing the way that I do. I believe that it's your body, all right? You need to maintain it. You need to be responsible for its function for years to come. You want to be able to add life to your days, not just days to your life, all right? You never want to rely on others to do simple things that you can do for yourself, but to fix your problems, right? But you want to know when to seek a specialist's help, all right? One example that I use is, our analogy is if you have a vehicle, you have a car, you know where the gas tank is, at least you know when you pull into the gas station, especially in New Jersey, which side you need to pull on, right? Or do you know how to add air to your tires? Or maybe change the oil, right? Or change the wipers, something, right? So it's simple maintenance for your car. But if there's something going on with the electrical system, your transmission, then you got to go see a mechanic. You got to go see a specialist. Same thing for your body. You should be able to perform simple stuff that you can do daily to maintain your health, your function. And when there's a problem with your transmission, you need to go and get it fixed and get it looked at, right? So this is a stretch that I would advise everyone with back pain to try at least. It's called a half kneeling hip flexor stretch. I'm going to pop up the video here. Now, there's a couple key points. If you've done this stretch before, a lot of times people will do it incorrectly, but this is the way to do it properly because the hip flexor crosses over several segments of your body. We want to make sure that all those segments are stable. So the first step is you got to contract your glutes. What happens is that when you contract your glute muscles, it puts your pelvis in a posterior tilted position. Now that contracts and stabilizes the insertion point of the hip flexor. The second piece is to keep your back flat by contracting the abdominals. Once those two pieces are contracted and stable, then we move the pelvis forward as a unit. And then if you want to, you can add the shoulder, the elbow up that pulls the fascia through the trunk a little bit higher. The thing that I see a lot of people do when they get into the stretch is that they just let their back hyperextend and they arch and they get too extended through the back and they go too far and they just kind of search for the stretch versus when you get specific with stretching and just like a rubber band, If you pull one end and not stabilize the other, you're just going to pull that band across and like, I don't feel a stretch. But if you have both ends of that band stable and you pull both ends and separate the both, then we've got a good effective stretch. All right. Next one is the cat to camel. And this is something that I've borrowed from yoga. Cat camel movement to the child's pose and cobra. It looks like this. You start on your hands and knees, and you can do this on the bed. It doesn't have to be on the floor, right? We start with your knees below your hips and your hands below your shoulders. And we just work on rounding your back and then extending your back. So we're working on flexion and extension. Now, like we mentioned before, one position might hurt, one position might not feel, one position might hurt and one position might feel better. I want to make note of that as we flex and extend the spine, right? And then we progress into more flexion, the child's pose, and then more extension, the cobra. If one position hurts and one position feels better, then we do more in one end. We do one more reps, more range of motion, more pressure into one direction and less in the other. Whichever one feels better, we keep doing. It's just like dosage. Any medication that you take, if you take 5 milligrams of a medication, it might not work, might feel good, right? But if you take 500 milligrams of that same medication, there's a therapeutic effect. That's the dosage that we want. When it comes to mechanical back pain, it's repetitions and time under the end range that is the most effective. All right. And then the self-trigger point release. Trigger point is what we call a tight knot in a muscle or muscle spasm. If we have issues like that, a tight back, this is one way to get rid of them. Basically, we take a ball or tennis ball, lacrosse ball, something, and we place it on your lower back. All right. The target area is above the pelvis, to the side of the spine, but below the ribs, that little square pocket in the lower back. That's generally where the tight muscle is. We could do this into the glute if you wanted to, that's fine. First thing is that we have to work on breathing. All right. Anytime that we add something like this, we push into a noxious area, the first thing is your fight or flight state goes on, right? It's like, oh, it hurts. I can stop breathing. We have to start to inhale and exhale deeply to allow the central nervous system to relax and allow that ball to get into the tight spot and that muscle to relax. And there's different positions here to increase the pressure and to stretch out or pin and stretch that tissue out by letting the knee roll out, bringing the knee into your chest, right? And for this, I would recommend doing it for at least 1.5 to 2 minutes to be effective, to first be able to calm down the central nervous system, allow that muscle to relax, and then, or your central nervous system to relax more specifically, and then have that therapeutic effect. Because again, it's like a fight or flight, sympathetic nervous system response, or the parasympathetic, which is the rest and digest. People with chronic pain spend way too much time in that fight or flight stage, and we want to be able to facilitate that rest and digest, that parasympathetic response. So breathing is important. Long, slow stretches, don't push into pain. Those are key points. And when it comes to exercise, your body knows movement. It doesn't know muscle. It doesn't know that, oh, I need to contract this one specific muscle at this one specific time. It just knows movements, right? So bending, lifting, whatever. So the key is to train positions and make sure that you integrate it with postures and movement so that you return to full function. We can't target a specific muscle. We're not bodybuilders or fitness, physique competitors where we're like, I need to get this one fiber in this bicep as prominent as possible, so I look good on stage. We're just trying to function as human beings. So we can't target muscle. We can bias muscle, but we really want to include also the brain when we do any exercise. So we can't just do an exercise just to do an exercise. It's really about understanding why you're doing it and feeling it correctly, because we want to feel the tension and the effort in the right muscle and not compensate, which the body's really good at, compensate by substituting a stronger muscle for the weak muscle. It's sort of like a hardware versus software solution, right? You have a computer, you have a laptop, a phone. Is it a problem with the programming, the programs and the software that you're running, or is it a hardware thing? Do I need a new disk drive or a new keyboard, right? So I need a new hip, something like that. So the first thing, close to the last things that we're talking about here is your core. In my experience, most of the people that come to see me that have chronic back pain they can't control this one muscle, the transverse abdominis, right? So the transverse abdominis is the deepest of the abdominal layers. It wraps around from the lower back to the front. If you've seen back braces, weight belts, it's basically an external support for this muscle. And oftentimes people have no idea how to contract it. So really quick, really easily, you need to check your core. All right, how do you check your core? If you just place your finger down onto your pelvis, it's really easy. It's a pointy part of your hip bone, right? Your pelvis. And we take that finger and slide it maybe about an inch or two towards your belly button. And I said, pull your belly button into your spine. So it doesn't matter what position you're doing it in. If you pull your belly button into your spine and you hold your breath, that is not your core. All right. Oftentimes people go, oh, I got it. I can't breathe, but I got it. So if you flex and hold that position by holding your breath, you're substituting the transverse abdominis with your diaphragm. So if you cannot breathe and your diaphragm cannot do its job, and you can't function, right? So every time that you're trying to lift something and you're substituting your diaphragm, you're just going from breath hold to breath hold. We need to be able to create tension in that area where your finger is and separate that muscle and feel that tension low into the pelvic floor and not be able to not substitute the diaphragm. So you should be able to breathe normally and feel tension where your fingertip is deep into that transverse abdominis. So this is an exercise I typically take my clients through lying down on their back. Lying down on your back is the easiest position to do it in because you're not fighting against gravity. If you're watching this, you're sitting in a chair, we're upright, you have to fight against gravity to contract that muscle, and it's harder. So lying down, try it again, lying down, and see how you go, how it goes.